Tiagabine Hcl is a medication that is used in combination with other drugs to treat certain types of seizures, specifically focal seizures. It works by reducing the spread of seizure activity in the brain. This medication is known as an anticonvulsant or anti-epileptic drug. When tiagabine has been used for conditions other than epilepsy, serious reactions, including seizures in people who have never had them, have occurred. It's important to talk to your doctor for more details before using this medication. The daily dosage and optimal timing for taking Tiagabine Hcl will vary depending on your condition and medical history, so it's important to follow your doctor's instructions carefully. Before starting Tiagabine, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with food as directed by your doctor. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. During the first week, it is usually taken once a day, and then your doctor may increase the dose to 2 to 4 times daily. Tiagabine is not usually used by itself, so do not stop your other anti-seizure medication unless your doctor tells you to do so. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Take this medication regularly at the same times each day for the best results. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. If you stop taking this medication for several days, talk with your doctor about how to restart it. And make sure to tell your doctor if your seizures get worse. Some common side effects of Tiagabine Hcl may include dizziness, drowsiness, stomach pain, diarrhea, nervousness, tiredness, or shaking. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as weakness, trouble concentrating, trouble speaking, or confusion. Additionally, a small number of people who take anticonvulsants like Tiagabine Hcl may experience mental or mood problems, so it's crucial to seek medical help if you notice any unusual changes in your mood, thoughts, or behavior. In the rare event of a seizure that does not stop, status epilepticus, it's important to seek medical help right away, as this is a serious side effect of the medication. While a serious allergic reaction to this drug is rare, it's important to get medical help immediately if you notice any symptoms of an allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, it's important to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Tiagabine, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss any concerns with your pharmacist. Before using Tiagabine, be sure to inform your doctor or pharmacist about your medical history, especially if you have liver disease, mental or mood disorders, or if you have experienced seizures that don't stop. Taking this medication may cause dizziness or drowsiness. Using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you know how this medication affects you. If you use marijuana, be sure to discuss this with your doctor. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, especially dizziness or confusion, which can increase the risk of falling. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Tiagabine Hcl, it's important to be aware of potential drug interactions. It's possible that this medication may interact with other drugs, affecting how they work or increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs, herbal products, and even over-the-counter medications. Be sure to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, sleep or anxiety medications, muscle relaxants, and opioid pain relievers. Additionally, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always talk to your pharmacist about using these products safely. If someone has taken too much Tiagabine Hcl and has serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help. You can call 911 or a poison control center for assistance. Symptoms of overdose may include severe drowsiness, uncontrolled seizure, slow/shallow breathing, and loss of consciousness. It's crucial to get help right away if you or someone you know may have overdosed on this medication. It is important not to share Tiagabine Hcl with others. While taking this medication, it is recommended to undergo lab and/or medical tests, such as Tiagabine blood levels. It is important to keep all medical and lab appointments. If you happen to forget a dose of Tiagabine Hcl, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to just skip the missed dose and take your next one at the regular time. It's important not to take a double dose to make up for the missed one. If you end up missing several days of taking this medication, make sure to get in touch with your doctor for further instructions. When storing Tiagabine Hcl, it's important to keep it at room temperature and away from light and moisture. It should not be stored in the bathroom and should be kept out of reach of children and pets. If the medication is expired or no longer needed, it should be properly discarded. It's important to consult a pharmacist or local waste disposal company for guidance on how to do this. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.